gonna try to keep this to a really short blurb. Um, I've been out of work on disability for about 2.5 months. I really want to get back to work, but I had this epiphany about why the United States doesn't have socialized health care. And I've never heard anybody express anything about it before in this sense. Here's the deal. I've been in the workforce for a long time, since 1983, doing all kinds of stuff. That's in the taxable workforce. Before that, I was in the underground, you might say. So the thing is that the older I get, the more I come across these people who the only reason why they're working their job is because they have health insurance that's subsidized or sponsored through their employer. That's the only reason why they're working, because they need that health care. That's it. They don't really care about the job. They hate working. They have kind of a bad attitude towards having to work. And every industry that I worked in where people were getting above 40 years old, they're not really interested in working. The only reason why they work is for the health insurance, period. That's subsidized through the corporations. Now, if all of a sudden there was socialized health care in the United States, this my hypothetical prediction on this is there's a whole bunch of people that would quit their job tomorrow because they wouldn't have to worry about health insurance. Now, there's all kinds of propaganda and everything like that about people in Canada having to wait 6 months for a procedure or this, that, and the other, and they have to come to the United States and to get something taken care of. Okay, I understand that part for like major surgeries and stuff like that. But there's also Americans who go down to Mexico to get cheap prescriptions, and they can get stuff done for cash that you can't get done without a waiting list up here anyway. So what'll happen is if they do social health care in the United States, there's a lot of people that are going to drop out of the workforce. And guess what's going to happen? The people who want to work, well, those people are going to be able to negotiate a higher wage. The market will collapse for corporations because they'll have to pay more for people that don't have to work because they need to keep their health insurance. That's it. And I still want to work. I like to work. I like my job. I love my job. And I want to get back to work. I hate this being at home all the time. It's stressful. It's boring. It's, I get time to post these videos. But as far as social health care, now as far as people coming into the country unlawfully, I'll put it that way, and they're kind of cheating the system, well, it doesn't matter. They're going to get social health care anyway because they're not Americans, and the way disability works and everything like that, they're going to be treated as though they have a disability or they're such low income that, or a refugee, or whatever term that allows the U.S. government to give them social health care that they won't give to people like myself. It's going to take me. I tried to file for SSI. I'm still waiting on that, but that's going to take 200 days for Social Security disability for me to get that. But these people who are coming over across the border are getting everything free anyway to begin with. Me, because I worked and I paid taxes and tried to live a so-called normal life, You know, if I need the benefits from my government, then I have to wait. Now, if I went over to Mexico and I had the cash to pay for it, I could probably get things taken care of a lot cheaper. Well, I don't have that kind of cash. That's the problem with debt. But anyway, now you know, and I've never heard anybody talk about that before. So, you know, socialized healthcare, it's probably the corporations that don't want socialized healthcare, because then there's going to be people that don't want to work in their crappy work environments. Man, I've worked in call centers. I did temp work for a couple of companies, and I got an office job. And it's just that for someone like me, that in the way I was brought up, is you work hard and you try to succeed and you try to improve your numbers. Well, all these people in the corporate world are doing just the numbers that they need to keep their job. They're not trying to excel. They aren't doing anything to get themselves in trouble. All they're doing is just milling the grindstone so they can keep their health benefits. That's it. Literally, I worked in several temp jobs. This is back in the 90s, and you know, the people that when I was doing airport ground transportation, these guys were independent contractors almost, and there wasn't any subsidized health benefits that I'm aware of, unless they were paying for it through a private thing, which was hugely expensive. Well, you got all these insurance companies that are making lots of money off of people paying into health insurance, and when they're young, when they're under, let's say 50 years old, you know, and they're still healthy and they don't have any bad habits, or work in an industry where they're not going to get sick, or you know what I'm saying. Those kind of things, as soon as they're socialized healthcare, those guys are going to be out of the work environment. And the corporations are going to be scrambling to hire people that actually want to work, because those kind of people like myself are going to be able to command a higher wage, and I'll be able to generate wealth for myself. So this whole system is anti-individual wealth, and I don't care about the socialist leftist theories and everything like that. Get everybody on the system so that they can sink the United States. That's not going to happen. What's going to happen is the corporations are going to be struggling to find people to work for them, because they don't want to work in a crappy office environment, or they don't want to work for a crappy company just for the insurance. It'll change the whole dynamic of the way people work in the United States. So anyway, I could ramble on about this forever and ever, but thanks for watching. I'm actually watching this on my or posting this through my cheapy COVID camera, because when this COVID thing hit, you know, Logitech, and in my opinion, they're the best camera makers out there. I don't care what anybody says. I'm not getting paid anything. But this camera, this COVID camera that I got, I paid $56 for a camera that's worth $12. If I move my hand too fast, you can see how fuzzy it gets. Can't keep the frame rate up. You have to manually adjust the focus on it. Everything like that is crazy. It's a total ripoff. So I'm testing how the sound is kind of on this, because I was using something else for sound, and I'm learning as I'm going here, because I've got the time. So anyway, before I start rambling way too much more, thanks for watching, and you know, keep in mind that the only reason why people are working, a lot of people, are because they have to have their health insurance, and the only way they can get health insurance is through their job. And once you have socialized health care, there's going to be a ton of people leaving the workforce because the only reason why they're working is so that they can have health insurance. And once they're socialized health insurance, guess what? They're going to quit and do a job where things will be easier. So anyway, thanks for watching, and what is today? I don't know what today is. Let's see. Yeah, I'm not going to worry about it. Have a good day. Don't work too hard. I want to work hard. Get me back to work. I want to get this foot thing taken care of. Because I am bored. Okay? I'm posting videos about BB guns. Okay? Because that's the only thing I can afford to shoot right now. Have a good one. Bye.